Hey there, thank you.
Thank you for joining us. We look forward to hear what you had to say. Thank you.
All right, sounds good. Hey, everybody. So I do have to correct my bio that you have. You don't have the newest version of it. My recent book that came out, Goodbye Lupus, Hello Delicious, is my now fourth best-selling book. Knocked myself off of the #1 bestseller list for autoimmune for that one. So I'm very excited about that. So I want to make sure that was updated. But it's nice to see all of you guys today, or at least see your face, your names throughout here. And the most important thing for me whenever I connect and teach is to help people understand where I'm coming from. So before I wrote any books, and before I earned a white coat, before I ever even considered a life and a career for myself as an adult, I started out as a patient. And so when I was probably about 12 years old, I started to get sick. I got sick at first with migraines. I don't know how many of you get migraines. They run in my family. And oh, thanks, Annette. I love you back. They run in my family. I always thought that was just a thing. My mom used to call them lost days, but they started both when I was between 12 and 14. They really started to ramp up to 14, where I'd be vomiting from the pain for days at a time. They did all the tests. I got the MRIs. They did all the things, and nobody could figure out anything particularly wrong. And so I was given medicine for pain and told that I was okay. And then when I turned 16, that's when I started to get a lot more symptoms. Thank you, Deb. I appreciate you too. You guys are so nice. I don't feel alone when I get to see interactions in the chat. Going out 16 years old, that's when I really started to get sick. And I started to get arthritis. What I found out was arthritis. I remember so clearly going with my friends to the Jersey Shore because I lived in Pennsylvania at the time and went to Jersey Shore to get the beach time in. And that the next day we all went to a diner in the morning. And I remember I woke up with the most excruciating pain I'd ever felt in my life up until that time in my shoulder. And it hurt so badly that I remember I couldn't raise my arm to eat. I just wanted to cry because I couldn't feed myself without this excruciating pain. And I thought maybe it was from the beach volleyball. Maybe, I don't know. And so then when I went home the next day, I went to sleep. The next day I woke up and it was my left shoulder that had the same exact pain, which is very weird. And I remember thinking to myself, I remember it clearly, even though this was over 30 years ago. I remember clearly thinking, it's my left, but it feels like my right. But it wasn't really my right yet because I eat with my right hand. And it was just a really bizarre thing because the level of pain I felt made it feel like it had to be something that was going to take weeks to heal, like a sprain or something. But the next day it was there. And then it just started to move. It went to my knees, it went to my toes, it went to one finger. It was the weirdest sensation. I remember I was telling my mom about this and she made an appointment with the doctor, but at the time that I went, then it didn't feel it that day. And then swelling started to come with the pain. And so sometimes when I went to the doctor, the swelling wasn't there. And so all they would say was growing pains, maybe, or, nobody really had any sense of what it was. And I looked fine. That's the thing about autoimmune diseases, especially, is that it's often invisible from the surface until it became visible. And I started developing rashes. And I developed something that's known as a butterfly rash, where I had this red rash all the way across from here to here. And that's why they call it a butterfly. It's like it starts here and then the wings go here and here. And I got this rash. And so I didn't know what that was. So I put makeup on. I was a teenager. I didn't want to have a rash. I thought I didn't know it was a rash. I didn't know what it was. And then one day I got all of it at once. I'd been at the pool all day with my friend and I came home and I had the worst migraine and I was just throwing up from this migraine. And when I came out of the bathroom from throwing up, then my rash was really bright. When you throw up, all the pressure increases. So now my rash is really bright. And I just felt like garbage. Everything hurt. And I came out of the bathroom and my dad saw my face and he went, "What is on your face?" I said, I don't know. I've been getting this on my face. And he said, I think something's really wrong. My parents called my doctor. My doctor told us to meet her in the ER. And when she saw everything together, she said, "I think this is lupus," which my mom told me later really pissed her off because she'd been taking me to the doctor for so long and nobody ever had any ideas and ran any tests. And now all of a sudden they were going to diagnose me with this terrible disease. And we'd never even met anyone with lupus. Back then it was more rare. And, she thought now she's going to diagnose her with a terrible disease. They did the lab test and it did confirm that I had lupus. So lupus is an autoimmune disease, meaning it's a disease in which your immune system starts to malfunction. And when it would normally attack things like cancer cells and flu viruses and bacteria and things like that to keep this organism safe, instead, it starts to attack some of your own organs, your own body, and it can cause all different kinds of symptoms. And there are different autoimmune diseases, right? Rheumatoid arthritis, people mostly get joint pain and fatigue. Then there's things like scleroderma, where it attacks the skin and there's a hardening of the skin. There's Sjogren's, where it can attack the mucous membranes and you can get dry eyes, dry mouth. There's all these different types of autoimmune. And lupus is one of those autoimmune diseases where anything can happen. It can cause all of the different symptoms of the other autoimmune diseases and more. And so in my case, what they found on that day in the emergency room was that there was an impairment of the kidney function. And that's a very common one for lupus, is that it attacks the kidney. And I remember thinking, I've always loved biology. I always wanted to be a scientist, even as a kid. And I remember thinking, like, how did this work? My immune cells were just traveling through my bloodstream. And every day they'd go, oh, hi, kidney. Hi, immune cells. And everything's fine. And then one day, one of these immune cells goes, what's that? And the other ones go, I think it's the kidney. And he goes, nah, never seen it before. And then they just were attacking. Like, is this how it works? And even to this day, I hear the body talk to itself as I think about all the different systems of physiology and how all of our different systems interact. But it was just a very confusing thing. And I think for many people, even physicians, it's often confusing. What is it that happens where suddenly the body can go from recognizing self to this kind of confusion? And what sends us over that limit where suddenly that can change? And is there a way back? Obviously, I'm sitting here. So yes, there is a way back, but it is a confusing and difficult and painful thing to go through. And at the time when I was 16, which again was over 30 years ago, we didn't even have all the new medications and things we have now. And my nephrologist at the time, after my kidney biopsy, told me that I had the most aggressive form of lupus nephritis. So it's not an easy thing to say. Most medical terms are in Latin, I think on purpose, just to make it hard for you to say it. But it was the most aggressive form. And he said, if we don't do something experimental, then I expect that within the next 6 months, your kidneys will fail completely. And nobody wants to hear any of that. Fail completely and experimental. None of that was something that any of us wanted to hear. But he said, if we can give you the high dose steroids and all the things we normally do, but I don't think it'll stop this. I think you will end up in complete kidney failure. And we said, well, what does that mean? And he said, well, it means that at best we can hope for dialysis, and at worst, you could die. So suddenly here I am at 16 years old, facing down this doctor who's a super nice guy. I love Dr. Levy. Hey, Dr. Levy. Really smart, amazing guy, but also very confrontational in a way that I appreciate. I was recently told I am compassionately confrontational. And I think he was too, but he needed us to understand it. Now, this was also, listen, I'm 47 years old. I predate the internet. I didn't get my first email address till college. That was when we first developed that. So back then, I think it was a positive thing for me that there was no internet. So I could look up what I had. And I think it's a good thing because it allowed me to really live my life without all of the scary stuff that people encounter every day on the internet. And back then, there really wasn't any good information about what to do or what to eat either. But we trusted our doctor. And so I did it. I did the experimental treatments, which were chemotherapy. And so I was told if I did the chemotherapy, that they thought what they could do with the chemo is shut my immune system off completely so that we could reboot it. So basically what you do when your phone is getting glitchy and you're like, it's not working. And then what do? You hold down the button until it shuts off. You wait, you say a little prayer to the computer gods, and then you turn it back on. And then ding, it just works, right? You go, okay, whatever that was, I guess we're fine now, right? So their hope was if for 15 years you had an immune system that worked, maybe it's just glitchy. And if we give you super high doses of chemotherapy, that typically when people with cancer use it, it's one of the reasons why people with cancer often die of infections is because the treatment to kill the cancer shuts off the immune system. And then when the immune system's not working, then the infection comes along and they can die of infections that normally they wouldn't have. So they were going to do this on purpose and say, well, if we shut off your immune system, both with high doses of steroids and chemotherapy, and they also gave me a whole bunch of other stuff. I remember I would take 7 pills a day, and they were giving me pills to suppress puberty. because they also knew that the chemo could give me ovarian cancer in the future and sterility and infertility and all that stuff. So it was a whole thing. And that's what I did from 16 to 18. I did the chemotherapy. They didn't know how much to give me. So at first it was going to be month to month, and then it was a year, and then they went for 2 years. So I did it for 2 years straight. And so from 16 to 18, while other people were just thinking about like the cute boy math class and prom and what college they want to go to, I was thinking about all that stuff. And okay, I have an exam on this day. So, and I have chemo this day. So I'm going to have to study, because after chemo, I am like a wreck for, for a while. I'd be throwing up and not able to study. So I was reading ahead in my classes and to keep my grades up, because the wonderful thing that I experienced that I want all of you to understand, and this is one of the biggest things that I have to help people with, besides just getting them healthy, or in order for them to get healthy, is to never stop living your life. I was just giving this talk to someone this morning, that a lot of times when people get sick, they stop everything and they just focus on the illness. And the goal is not to stop living. The goal is, if I focus on this illness, then I can recover faster and then I can get on with my life. But the thing is, life doesn't pause unless you pause it. And so one of the things that I learned from my family, and I have an incredible, wonderful family, and my grandparents are Holocaust survivors. So they, at 16 years old, my grandmother was in a prison camp. So I was still way better off than where she was at my age, starving and abused and living a horror movie. I lived at home in a middle-class family, and I got to go to school, and I had doctors, and I had all these things. So one, I always feel grateful for my life. And I want that for all of you. If you woke up today, you are winning. Do not forget what a gift it is to be alive and here right now. No matter what body you're driving, if you are listening to the sound of my voice right now, you are alive and winning. Be grateful for that gift. There is hope in that gift, and there is life, and there is goodness, and there is connection, and you can have passion and purpose regardless of what's going on with your body if you choose it. So that was one thing. And so with my family, there was never this like, maybe you should drop out, or maybe don't go to class, or maybe don't take all AP classes. None of that. It was, you have an illness and you have a future. So we got to do whatever it takes to manage this illness. You take your pills, you take your chemo, you do your thing, and you go to school and you learn and you get good grades and you focus on your future, because you're going to have one. And so that's what I did. And it made my life still good in spite of my illness. It wasn't like I went from having a full life to being a person with lupus. I went from having a full life to having a full life and a disease to manage. And that's what I did. And there were some days that, yes, I hurt too much to go to school, and I would spend that day in bed. There were some days where I threw up all night from chemo, or I'd be twitching from the side effects of the medicine that was supposed to make me not throw up from chemo. That was a rough night. I never watched so much Three's Company in my life, because I couldn't close my eyelids because of the medicine reaction. So that was what was on all night long, through like till 5 a.m. was Three's Company. But I just managed. I just found a way to focus on the life that I had and be grateful for it. And because of that, I believe that's one of the reasons why I was able to get through all of this. One, at the end of that 2 years, my kidneys actually went into remission. Meaning there were still some issues. You could see I had protein in my urine. I was told I would always have protein in my urine because of the damage that was done to my kidneys, but I was no longer considered in kidney failure. And the lupus was said to be in remission. Now, remission, I put it in the finger quotes, because remission with autoimmune disease really just means that you are stable and not dying, but it doesn't mean you don't have the illness, right? So it's not like when people go in cancer remission and it means there's no cancer cells. In autoimmune remission, it just means like you are stable, not progressing, not dying. So I still was taking steroids, but I no longer needed to take the chemo. So that was cool. And I went from 60 milligrams of steroids to 20 milligrams. So that was cool. I still had to take, I got to stop taking the hormone suppression because I stopped the chemo. So that was cool. Right? So I was on less medication and I was stable. But if you looked at my blood tests, they were positive for lupus. I had positive ANA, dsDNA, all the things you would expect to see with lupus if you're into that. But I was stable and I was happy. I took my medications for pain. So for me, the COX-2 inhibitors were the bomb. Ibuprofen did nothing, but my Vioxx, Celebrex, they worked. I took those. I had medication that I took for the migraines. And at the end of that 2 years, not only was I considered clear to stop the chemo, I got my first choice in college. I graduated in the top 10 of my class in high school. I got a scholarship to my dream school, Carnegie Mellon. And I was just excited to be alive and getting to go to college and not have chemo. And so I've always lived in that space. And I highly recommend, if you've gotten lost in disease, and if that's why you're even watching this, a lot of the folks I see, their whole life becomes about health. And their whole life becomes about sickness, and they forget all the rest of it. And so you don't want to focus just on health. Health is just a vehicle to help you enjoy life more. So make sure your focus is on enjoying life more, and then do what you got to do for your health. Exercise, eat well, sleep well, do self-care, and then live. You have a purpose. Don't forget that. Whatever your purpose is, whatever it is that makes your heart beat a little faster, that's your gift. And really, what you need to do is give your gift for yourself and for all the rest of us who need it. So don't forget that when you're trying to figure it out. Now, I was able to get through college well. I could control my sleep. I could rest when I needed to, all that kind of stuff. And it worked out for me. I did very well in college. I actually did medical research at college. It was really, really cool. So I was able to do undergraduate research in neurobiology and genetics. And that was really, well, the thought part of it was fun. I loved solving problems. I got to publish on my first paper back then. But sitting in a lab all day was not my jam. So I decided that that wasn't going to be my path. I originally thought maybe I could be a researcher that finds a cure for lupus. I really did think that back then. And then I did medical research or undergraduate research, and I went, I don't like this. I need to be with people. I am meant to be with people. And so I decided instead to go to medical school. Originally, I was enrolled as an MD PhD because of the research I did. And then I realized, you know what? I want to be with people. I want to hold their hands. I want to look in their eyes. I want to be there for them. I want to be an example for them that you can live with chronic disease and you can have a life that you want to live. And I thought that could be the best I could do. Maybe I would never cure a disease, but I could teach people that they could have a good life with chronic disease. And so that's what I decided to do. So I went to medical school, and I remember, you know, my grandmother, my Holocaust survivor grandmother, she was there the day I got my diagnosis of the kidney failure. And it was the only day I'd ever seen her cry. And she was both the most joyful person I ever met and the toughest person I ever met. And even when my grandfather died, I'd never seen her cry. But the day that I got my diagnosis, she did. And she was sobbing on her knees, screaming to God, like begging him to just take her life and spare mine, that she'd lived enough just to let me live. And then when I survived, she used to kept just asking for more favors from God. She'd be like, I just want to live long enough to see her graduate high school. I want to live long enough to see her graduate college. I want to live long enough to see her graduate medical school. And she actually did. She did live long enough to see me graduate medical school. And here, I'll show you a picture. Let's see, I'm going to share my screen here, there. Let's see if this works the way it did there. Okay, so let me just move past this one. Click it here. Okay, there she is. Look at my cute little grandma. I love that she's in front of my dad because she was like 5'1" and he's 6'7", so it just like really should. But the problem is, you could see here, I got a bit of a moon face. I got sick in medical school. So while I was able to stay well in college, by the time I got to medical school, I was actually sick again. My kidneys stayed stable, but I started developing blood clots that were traveling into my brain, and they're called mini strokes, if you want to use layman's term for it. So I was having these mini strokes, and I was very sick. And I was sicker than a lot of the patients I was seeing, actually, because I'd be walking through the hallway and my vision would go into double vision from a blood clot passing through into my brain. And I would hold on to the wall until the vision came back together again. And then I'd keep walking and see my next patient. Pretty wild when I think about it now. But I was put on blood thinners. You can see the moon face from steroids and things. You know, I was just trying to survive. But I was there. I graduated. And again, I felt so freaking grateful to be able to continue to live my life. That in spite of everything that's ever happened to me, there I was becoming a doctor, which was my dream. And I was just really, really grateful to be there. So it's my beautiful mother, my other grandmother. So it was a really, really cool day. Now, right at the time I was graduating, something happened that changed everything. So I really thought this would be my life, is I would be the moon-faced sick doctor who is there smiling, helping my patients, helping them live a life that they could enjoy in spite of whatever it is they're going through. That was my goal. That was my dream at the time. And it would have been enough. But at the time that I was graduating, I also had the great fortune of falling in love. And some of you might recognize my handsome husband, although he does not have that fringe of hair anymore. This is back when we were 28. And I got my residency, my first choice at UCLA Harbor residency program in Los Angeles. And so I was in palm trees and I grew up in the East Coast. It was New York and Pennsylvania. I went to college in Pittsburgh, medical school in Philadelphia. So the palm trees were really, really nice. So anyway, I had just met him, and he's just an amazing guy. We fell in love very, very quickly. And it was one of those things where the moment we met, we knew it was meant to be. But I had to explain to this beautiful, like just brilliant, amazing guy that I have a disease where I am not going to live a long life. You're going to have to take care of me when I'm disabled. I'm not going to be able to have children because between the strokes and the kidney failure, I was told it would be a death sentence. And so it was just one of those things where it was like, I was afraid to tell him, but I had to tell him, you have to know what you're signing up for. And he was just amazing. He just said, I'd rather have a short life with you than a lifetime with anyone else. And I want to get married. And I was like, okay, let's get married. So I was very excited. And he's really a beautiful person. I haven't talked about his backstory as much. He often does when he gets to be interviewed, and maybe one day he can teach about metabolism here. He has his own best-selling book about how to create a rapid metabolism using nutrition. And it's one of the reasons I'm sitting here right now is because of it is the reason I'm sitting here is because of his protocol. But what was so beautiful about him, especially besides his mind, was this amazing heart. And his best friend, the person who knew him best, the person who made him feel the most seen, had died of cancer when they were in their 20s. And so he had told me that for the first time since losing his best friend, he finally felt like he had a best friend, that he finally had that relationship back. And then he had to hear that he could lose me too. So I just want to acknowledge the bravery it took for him to open his heart to the idea that he could love that big and lose again. And he did it anyway. So, and there's the tears, but he is just an incredible human. And I'm so glad to spend my life with him and to heal others with him. He is an incredible big heart. I always say, I'm trying to help people save their life. And he always says he's going to save their wife. But we do it together, and it all is an act of love. It all comes from our love together. So what happened was, if you don't know this story, is when we decided to get married, I asked him to put me on his protocol, which at the time he was still doing the scientific research to try to discover what is it that is the optimal diet for human health and metabolism, because he wanted to just help people get ripped. He was just looking for aesthetics, that there should be one perfect way to eat for every human who wants a six-pack to have a six-pack. That seemed to make common sense to him, right? That like every animal on the planet should have an optimal diet. And for some reason, even when he was getting his graduate degree in exercise science, nobody knew what the optimal diet for humans were anymore. You could ask a biologist about any animal on the planet besides humans, and they will tell you what their diet is supposed to be. But if you ask them about humans, suddenly they don't know. They don't know. High carb, low carb, high protein, low protein, I don't know, biodiversity, what? No, right? Like all of a sudden they're confused. And that drove him crazy. My husband came from a background of computer science and mathematics before he went into biology. And in computer science and mathematics, there is always an elegant solution that is the best solution. And yet when he went into biology, it was chaos, and it drove his Virgo mind crazy. He needed there to be a best way. And so that's what he was studying. And he had come up with a lot of the good stuff already. Cruciferous vegetables in their raw form and their ability to accelerate cellular repair metabolism, omega-3 fatty acids. Oh my God, what they could do to make fat loss more and more rapid, as well as muscle building, water intake and its impact on metabolism. And so he was already found all of those aspects. Now, at the time, he didn't know yet about the negative impact of meat animal proteins, right? He did know that certain things made you fatter, like saturated fat, like dairy, egg yolks, stuff like that. But he still thought that lean proteins would be a good idea for muscle building. He's since proven that you can build more muscle on half the protein on a plant-based diet using his protocol. But at the time, he thought you needed it. Now, I've been a vegetarian since I was 12 because I liked animals, right? That was the only reason. But I ate terribly. I ate the best diet to be overweight and sick, which is called hospital food. And so I was eating that. And this is how I got into. Now, listen, I wasn't obese, but I used to work out. And I still didn't have a body that felt like I worked out. That's just a buddy of ours. Tom knows him, it's fine. But, at the time, I was like, I was going to the gym, I'm eating hospital food, and I'm like soft. I'm overweight. It's not what I wanted, right? And so I asked him to put me on a program, and he had to take the meat out because I wasn't going to eat it anyway. So he made the first version of his program that was plant-based. And what happened is in 3.5 months, I went from a size 11 to a size 3. I'll show you the picture. Here's us at our wedding 3.5 months later. And for the first time since I was 16 years old, I'd been sick for 12 years straight. 12 years straight with positive labs and markers for lupus, positive symptoms for lupus, migraines, pains, and rashes. For the first time in 12 years, I had negative labs for lupus. So something happened where we created this fast metabolism, and I know he looked great too. We created this fast metabolism, and that also seemed to equal health. Now, at the time, I was just a doctor that just graduated medical school, and I didn't realize that the reason I was better was my nutrition, because after all that training, if nutrition mattered, they would have told us, right? Right? Guess what? No, nutrition never came up. So even though I was better for the first time in my life, I thought, I didn't know why. Oh, it's a weird remission. In fact, they thought it was a lab mistake. So they sent me back to get my labs retaken, and they were negative. And my cholesterol, which had been high since I was 21, and my doctor said it was just genetic, blame your parents, direct quote. My cholesterol was 155, right? And my blood clot antibodies were gone. Everything was gone. Nobody knew why. And we just shrugged and said, maybe it's luck, maybe it's love. However, I'd been in love with him now for 1.5 years. And my labs were still the same. It wasn't until I changed my diet that they changed. But you know what? I was busy, stuff to do. And we were so happy to be in love and getting married that we just went on with our life. We didn't realize that it was the food until after I did the impossible. After 4 years of being healthy, we went ahead and did get pregnant. And even though the doctors freaked out and said, this is going to bring the lupus back, here's my labs right before I got pregnant, not before I get pregnant, sorry, right before I changed my diet. There's my clotting antibodies, there's my lupus antibodies, all positive. That's in quote remissions. And here I am pregnant, negative for all clotting antibodies. So they wanted me to take blood thinners, but I'm like, for what? I don't have any antibodies, right? And then same thing, you know, there's my ANAs positive and then my ANAs negative. So even though I was pregnant, I still had no lupus. And that's when we realized what had happened at that point. You know, we had our beautiful son, Solomon, and this was 9 days after I gave birth. I was back to my weight before I had given birth, before I got pregnant. So my husband did this photo shoot that you're looking at right now. He did front, side, and back. I'm not going to make you look at all that. But he goes, look, you proved my metabolism theory that a fast metabolism should be able to return back to the optimal state as quickly as possible. But what we also realized was fast metabolism is not just about whether or not you have a six-pack. Fast metabolism is whether or not your cells can react in real time to what you needed to do. I was able to get pregnant, gain the weight I needed for my pregnancy, have a healthy birth, be back to my pre-pregnancy weight 9 days later without doing anything. I was just nursing, eating, and sleeping, right? And I was lupus-free still. And I can tell you right now, I'm sitting here at 47, and it's just about 19 years that I've been lupus-free, in spite of having 2 kids, in spite of everything that's ever happened to me, everything I've done from there. I have never had a relapse. And it's not just me. I could do this all day. This is Julie. She did my 4-week rapid recovery program, and she was so exhausted. When we met, she was anxious and pain, exhausted. She could barely take care of her kids. She couldn't work. She did 4 weeks rapid recovery, and after 28 days, she had great energy. Her daily anxiety was gone. Her stress was gone. And she got so much better that a couple months later, her rheumatologist fired her, and she started 2 new businesses in addition to running around with her kids. And then she goes and checks her thyroid, which also was a problem for her in addition to the mixed connective tissue disease. And she got a text from her doctor. Didn't she used to be hypothyroid? Yeah, her thyroid healed too, right? 4 weeks. This is someone who just followed my free content, because my husband and I, we've given our protocols away for free. I'm doing this talk right now, 2 hours of my day for free, right? I do this all the time for free because I want people to get better, and I want it to be clear. There's no money behind this. This is for you because it works, right? This woman had Graves' disease followed me for free, and she was able to already reduce her antibodies and get rid of the other antibodies on her own, following our protocol. This was the first client I ever had for working with in this way and in health. and nutrition. This was him on the left on the best medicines could offer. Lupus, scleroderma, and Sjogren's, in and out of the ICU since he was 14. This is him only after 6 weeks. All of this healed. This was on medicines. This was him coming off of medicines, okay? Same thing was happening to his hands. Look away if you got problems with it, but scleroderma will harden your skin so much that if you bend your knuckle, it opens up and you can't heal it. And this was so painful, the doctors told him the only thing they could do was amputate his fingers. And yet, here's on my protocol, off medications, everything heals. That was him off his medications. He went from living at home because nobody would hire him because they couldn't look at him to not only having a job, but those fingers they were going to amputate has created three-dimensional art, and he's won art competitions in Los Angeles galleries. And that's what my work is about. It's about taking someone who is sick and suffering and giving them the tools they need to live their dreams and give their gifts. That is what my job is. And that is what I dream of doing. And even at his job, they call him the rabbit. So instead of a cake, they gave him carrots for his birthday. This is a nurse. I have a lot of doctors, nurses, and pharmaceutical reps that come and see me for help. I'm actually doing rapid recovery right now with a pharmaceutical researcher. And I'm always honored when they choose me because they do it because they know when they hear me speak that I understand the science. I'm not talking woo-woo, although I'm good for whatever works for you. I know the science of nutrition and disease reversal. And so I'm always happy to see, when healthcare providers come to me. Now, why do they come to me? Because guess what? When your healthcare provider gets sick, they Google too, even though they yell at you for doing it. So Nurse Peggy, rheumatoid arthritis, this is what she looked like when she joined my 6-week rapid recovery group. So rapid recovery is just a program where I work with people every single day to make sure every aspect of their life and their diet becomes anti-inflammatory and they get better. I obsessively breathe on you so you can feel my breath on your neck to make sure you get better. Look at the size of this poor, swollen, painful wrist. This is her at the end. She couldn't even bend it at the beginning. 6 weeks later, right? Another one, Jeannie, 6 weeks, lupus gone, and her clotting antibodies gone. And that was at 70. This woman followed me for free online. This is her on medicines. This is her just on my protocol. Look at that. Less than 3 weeks. Nothing else helped her medically, and the nutrition did. She just sent me that. Mariana, she did my rapid recovery group because she had such bad lupus in her brain. She was having seizures all day long. This is her lupus antibody. She came to me right after the ICU, lupus antibody over 3,000. And then she did 6 weeks in my group. She decided to stay another round, down to 84. This is what the nutrition does. The antibodies are dying off, and she stopped having seizures. She was having 3-4 seizures a day. She stopped having seizures after the first week. This is someone who did my rapid recovery group. I just was in touch with her. She did my group back in 2018, and she's still doing great. So this woman, she's been sick for so long that her doctors have been following her for almost 10 years, and they could not believe that her liver enzymes were normal, her inflammation from her eye that she'd had for 10 years was gone. All these things were gone in 6 weeks, and she'd been seeing these doctors 10 years, and they couldn't help her. And even more fun was that her son, who had lupus, was following along with her when she was in my rapid recovery group, and his lupus went away. And I just texted her yesterday, and he's still lupus-free off all medication, and he just ate what mom ate while she was in my group. And her doctor was so excited because he'd been seeing her since she was 18 that he wanted me to teach gram rounds. Now, it was during COVID, so I didn't do it, but maybe we can reconnect on that. This is someone else followed me online, said goodbye to MS. Look at her go. She just followed my book, Goodbye Autoimmune Disease. Here's another person, MS. Not only do I see improvement of their symptoms, but the lesions on their brain MRIs will go away. All right, very, very important. This is another teacher who did my group. She was told she was never going to be able to walk again. This is her at the end of the 6-week group. It was a video, but I never take risks on videos anymore in live presentations, but that was her showing off her walking at the end. These are 6-week results, my friends. I'm not talking about something that will just, try it for a year and see if you feel better. These are people I work with every day and what their results typically are at the end of the first month, month and a half. Jackie, oh my God, my Jackie. She did my rapid recovery group, lupus, mixed connective tissue disease. She had bullous pemphigoid disease. She was so disabled. She had learned about her program, but had never been able to get herself to stay on plan. And she decided to do it to fight for her life and her grandkids. And by the second week, she was able to use her hands in a way that she had never been able to for years. And her husband came home at the end of the second week and found her moving furniture when she couldn't even hold a pencil when she started. That's how exciting it was. So her mouth ulcers went away next, then the blisters that stopped her from being able to wear shoes. And in the final meeting, her husband actually joined with her, and he was crying in the final meeting. She was showing off holding the pencil with all of these things better. It was absolutely incredible. She posted in Smoothie Short, our free group, a while later, just to show off, look at her showing off how she could jump around and have fun with her grandkid, which was really all she wanted to do. She was considered lupus free. This is what I live for now. This for me is the reason why I've been sick, and what my job is to do now for others. I've treated mystery diseases. This doctor couldn't walk without taking prednisone. She did she did appointments with me, and then she didn't need prednisone anymore, and she could walk again. And because she was the head of the internal medicine department, she said she was going to give my book to all of her residents. I've helped children. This child had lupus in her lungs, her heart, and her kidneys. She was a code blue. They had to bring her back to life. And I worked with her and her mom said I could share the texts. Heart back to normal, martial arts, kidney was back to normal within a couple of weeks. She graduated high school as a straight A student, and she doesn't let me show her face anymore, but amazing recovery to be able to continue the rest of her life that way. I've treated a lot of kids. It works for HPV, reversed abnormal pap smears, reversed cervical dysplasia, and of course, it's great for weight loss as well. The metabolism part does work. This is someone I found on YouTube, got rid of her endometriosis. This is a guy I met at the gym who got rid of his food allergies. This is Bernard, who in 5 weeks completely eliminated glaucoma, completely gone after 5 weeks, as well as his diabetes. Peripheral neuropathy from chemotherapy. This is someone who's able to heal that within 6 weeks and after doing rapid recovery. And this one, I want to tell this little story before I get to the science. I want to inspire you and then show you the science because I got to convince you to listen to it, right? So Rachel, she did my 4-week rapid recovery program because she had lupus, and her lupus was so severe that when she had her first child, she had to stay in the hospital. She had a miscarriage, got sick again, and so she was pregnant and terrified, and she felt bad. She'd already started her maternity leave because she was so sick. She had to stay home and lay on her couch. Well, by the end of the 4 weeks, she was actually teaching her daughter how to fly a kite running through a park at the end of the 4 weeks, right before she had her C-section. And she also couldn't tolerate any sunlight before, and she was able to tolerate sunlight. So at the end of 4 weeks, she had a healthy delivery. She didn't have any lupus or Sjogren's symptoms and has not had any since then, okay? Now, there's her lupus rash. You can see her skin is clear. But also, since the pandemic, she's had 2 kids since then, no relapse. Okay. Now, after this happened, her mother-in-law got really sick. So this is Pearl. Pearl was sick in the hospital. And at the time that she was in the hospital, she was now told that she had her final heart attack. Her husband was called. So Rachel's husband got a phone call and said, your mom had a fatal heart attack. She's still alive, but you need to come say goodbye. At the time, she'd had 25 heart attacks. She'd had 20 angiograms. She'd had 10 stents. Her first heart attack was at 41. She was diagnosed with chronic heart failure at 2 years prior. She was type 2 diabetic, insulin dependent, had been diagnosed with diabetes at 38, okay, and had been using insulin since 92. And so she had her fatal, what they said was the biggest heart attack. And so he flew out to say goodbye, and that his mom's heart was too sick to heal. Now he had just watched his wife heal from autoimmune disease. He had just watched Rachel do this. She just had the baby. So he brought the blender to the hospital, gave his mother nothing but my green smoothie recipe. And 5 days later, she walked out of the hospital. And that was back in 2017. All right. So only 1 year later, she was doing great. She was off her cholesterol meds. She had minimized any insulin use. Her blood sugars were normal. No more chest pain, no heart symptoms at all. Massive weight loss. This was her a year later. Again, that's 2017. That's 2018. This was her recently, still enjoying her grandkids and perfectly healthy and slim. Look at her. So now it's the wife, it's his mother. And then what happens? Nir gets sick. And I said, Nir, what are you doing? He said, I've been so stressed about my mom and my wife that I've been eating like garbage. So we put him on the same program. And I said, listen, first of all, it's time to get into some therapy. You can relax. Your mom is okay. Your wife is okay. But you are in danger and they need you. And, you know, we worked on the emotions and crying and like letting himself feel, got him on track. And what happened was He listened to me, and you can see this one is not eating what she's eating, right? He was eating something else at school where he's a teacher. Well, only 3 weeks later, texting me, I feel like a new person, working out 3 times a week, working on himself, reduced his medicines in half already in 3 weeks, and his fatty liver was already gone. 3 weeks later, right? So it was less than a month. He'd had chronic fatty liver for years and nobody knew why. And you know what? Didn't matter. And on top of that, 6 weeks later, we checked, not even a hint of diabetes, completely gone. This is the kind of the time frame of the results when you optimize nutrition. So anytime you change your diet for the better, you're going to get some good results. When you optimize nutrition, the way we teach for cellular recovery, the body can do amazing things in rapid time. And there he was right after he finished. And this is why I love to tell that story, because these are their kids. All right. So this was the guy that was in her belly when she was pregnant. This was her daughter that was already here. And here's the newer one. So cute. And the cool thing about this, and what I want all of you to realize, is when you do what's right for you, you start a domino effect that can change things for everybody. And in this family, these kids have the genes for autoimmune disease and heart failure and diabetes and liver failure. They have all of those genes. But the diseases stop here because these kids eat a hyper-nourishing plant-based diet, and they are healthy and brilliant and wonderful kids that don't have to be afraid of illness. And that is where the power is. This is a generation of children that is the sickest we've ever seen. They live on ultra-processed foods. They are already getting diabetes and heart disease and autoimmune diseases as small children that we used to only see in adults. We can do something better for them, and I think we owe it to them to do so. Now, I have published what I've done. This is in reversing kidney failure, getting someone off the transplant list. This is my newest research that was just published, a case series where the 3 women with lupus and Sjogren's combined, highly symptomatic on medication. All 3 of them were asymptomatic within 2 to 6 weeks. And all 3 of them have remained asymptomatic on my step-down plan for 3 years, 6 years, and 7 years with no relapse. So there's ways to get that. And people have heard of me at this point. I really just wanted to work with the homeless. I never had any desire to be on camera, actually. Yes, I'm an only child, but no, I just wanted to quietly work with the homeless until I felt like I needed to teach this. And so people have sought me out. It has grown completely naturally. I've never, promoted or paid for followers or any of that stuff. I just do things that work and people share it. And it's just organically grown from me having 100 followers to me now having over 100,000, which just blows my mind just by doing the work. So I've been in the movies and on TV, and I'm on the news constantly. I actually just turned down a news bit for today because I had to be here. And I'm like, I'm sorry, I can't come on, but they'll call me if they need any health stuff, plant-based news. And if a lot of people like to go to T. Colin Campbell's eCornell course to learn more. And so I'm their autoimmune professor. And I have now been on the health advisory board for Forbes for 2 years now. So I get to medically approve research articles and give feedback when they make mistakes. And I always make sure those articles that I edit get information about how nutrition and health can affect those diseases that the author is writing about. And all this really means to me is my message is getting mainstream. I love being able to teach in places like this, but truthfully, most people out there are not coming to conferences like this. They are not looking online. They're listening to their doctor and they are hopeless because of it. And so all this means to me is my message is getting out to the people who need it. And that's what matters to me most. I want it to be that people just understand how to eat for their health so they don't have to lose their own life, and that people don't have to lose the people they love unnecessarily because they didn't know. And that's what that means to me. Now, I do teach a lot of this. One of the things that I love getting out there is making connections between what's going on in research and what we've been teaching, right? So there was Crick Institute was trying to do research to figure out why autoimmune diseases have been rising and spreading into areas of the world that never existed in before over the past 40 years. And they thought maybe there's a DNA cause, maybe we're mutating, right? Maybe. And then what it turned out is there's no change in our DNA, but the rise and spread of autoimmune diseases around the world, including things like Crohn's and ulcerative colitis in areas like the Middle East and Asia where it never used to be, was entirely connected to the rise and spread of autoimmune disease, right? On top of that, there was studies that showed that COVID was tied to how sick people got from COVID, was entirely tied to what their diets were. And this was a really, really cool study. And what they found was, this was back in 2021 when things were still new and we didn't know what to do about COVID. They actually looked at, it was from Colombia, they studied almost 3,000 healthcare workers from 6 different countries. And what they looked at is, did they get sick from COVID? How sick did they get? And what did they eat? And did they identify as plant-based, pescatarian, high protein, or just like standard American diet? And they adjusted for all the other variables that can make you sick. And the results were really striking. So what they found is that people who followed what they called a plant-based diet had 73% lower odds of experiencing moderate to severe COVID-19 compared with others. 73% lower risk. That's not a small thing. Pescatarian diets, 59% lower risk. So, okay, better than most people, but not as good as if you take that fish out. I guess fish isn't so healthy after all, right? And people who ate high protein, low carb diets, 48% higher risk of moderate to severe infection. It was deadly. And one of my husband's good friends died of COVID in the first wave. And he was one of those really buff guys who looked super healthy, felt amazing. He was really successful and famous in the fitness industry. He died in that first wave, and he was on one of these type of diets, right? So that was a really striking thing that they found. I mean, 73% lower risk versus 48% higher risk if your meat is mostly meat versus all veg versus mostly veg. And so what they thought at the end of that study was, okay, conclusion is if your diet is rich in nutrient-dense foods, maybe that protects you. So since plants have nutrients and meat doesn't, maybe that's the issue, right? But what they didn't address, which is what I've been bringing to this when I talked about the study back then, is the deleterious or dangerous effects of meat. Why is it that if your diet's mostly meat, you die quickly from COVID? But if your diet is mostly plants, you're very protected. But just eating a little bit of meat, just fish, which some people don't think they're eating meat when they eat fish, but fish is not a vegetable, right? So just eating a little bit of meat, boom, they lowered the risk. So they got the protection of the nutrition of the plants, but they still had a higher risk of COVID than the people who ate no meat at all. And I think that was a really important thing that was not discussed in that article. And it shows what I've been doing for a long time, is that I find that if people hyper-nourished, which I'm going to teach you what that is, and they still eat some meat, they tend to have much better health. But if they take the meat out, boom, does it skyrocket. That gentleman that I showed you, David, who had the rashes on his face and the fingers, he was able to get symptom-free by doing my diet, and he was still taking medicines, but symptom-free and feeling great, and he only ate meat once a week. But he still had to take his medicines. Finally, after 2 years of that kind of remission, I got him to stop the meat entirely. Within 2 weeks, they took him off his meds. So again, there is, if you minimize your meat intake, you're going to be much healthier. If you take it out, you're going to optimize your health. And that was an important part that was missing. There was also another study that was done by Harvard that found that healthy plant foods lower your COVID risk. In 2022, a Brazilian study, mostly plant-based diet, went to 39% lower rates of COVID-19. So it was repeated over and over. Now, the other thing that I loved with this group over, this is me on the news again, which I found it funny. They were interviewing me and they both wore smoothie green. That was really cool. I love these guys. They're really, really nice over at ABC. But what they also found from Johns Hopkins research is that there is an ingredient in cruciferous vegetables called sulforaphane that actually prevents COVID-19 and other viruses from replicating. So they found it decreased their ability to replicate by 50%, in half. And not just COVID, but flu viruses as well. And so they found that even if you already had an infection, if you took in the cruciferous vegetables, you could reduce that infection. And that's what we found. I've worked through the pandemic in rapid recovery, healing autoimmune diseases, and people would be on my plan for their autoimmune disease, their whole family's sick with COVID, and they're not, even though they're immunosuppressed. So that was pretty amazing to see that. And now we're seeing some of the reasons why. They also found a decrease in the viral load in the lungs and upper respiratory tract and amount of lung injury compared to controls when they added this ingredient from cruciferous vegetables, and decreased inflammation in the lungs, which also I have found, I've helped people decrease their oxygen needs after being on a respirator from COVID. I've helped someone get off the lung transplant list with autoimmune disease in his lungs. And that's what we find is the lung inflammation comes down. So they found that, just these ingredients, cruciferous vegetables, are also protective and can kill cancer cells. Very, very important. So, it's one of the reasons why we're seeing now research that supports what we've been teaching for over a dozen years about the benefits of these certain types of foods in cellular repair, cellular function, and recovery from illness. It also has helped with long COVID. Everyone I've worked with long COVID has been able to fully reverse it and get their energy back and feel great again, usually within 3 weeks. So what do you want to learn from that? Well, healthy immune systems can do a few things. One, they can reverse diseases. Here I am. All right. It's been 19 years, no relapse. I've helped other people have many, many years. David, it's been over a decade, right, of no relapse. It can reverse diseases. It can fight diseases, killing cancer cells, killing viruses, and making sure they can't replicate, and helps you recover from disease, brings that inflammation down and lets you recover. So how do you do it? Well, I developed a program. If any of you have read Goodbye Lupus, it's all about my 6 steps to healing with supermarket foods. The first 3 steps are eliminating the stuff that makes you sicker, right? I mean, that makes sense, right? My husband used to do this joke when he would do his fat loss seminars, and he'd say, all right, you want to know the first secret to rapid fat loss? And everybody would lean in and he'd go, stop getting fat, right? That is like, if you want to get healthy, stop getting sicker, right? So most of you are going to hear here at this conference, if you haven't already, certain things make you sicker. I was just teaching all last week and the week before. I've been doing news hits on the new research showing how ultra-processed foods are increasing your risk of dying from anything by 20%, and that's with 1 serving a day. The average American has 60 to 70% of their calories coming from ultra-processed foods. It increased your risk of dying from heart disease by over 50%, increase the rates of dementia by 30% to have 2 servings a day. So these things are all deadly. Oils for the most part, unless it's an anti-inflammatory oil like flax oil, right? So these things are making you sicker, all right? And I don't need to teach you what animal products look like. I'm just going to tell you the part that you're not hearing. So other people like to talk about animal products versus heart disease. And yes, 100%. As I said, I've reversed heart failure. I mean, Pearl walked out of the hospital in 5 days. That's pretty darn fast, right? But I like to show people the impact of how nutrition affects your immune system. So arachidonic acid is an important nutrient that's found in omega-6 fatty acids. But while you get the right amount of it from plant foods, your vegetables, some nuts, when you eat animals and animal products, you get a super, super high amount. And when you do that, this is the inflammatory immune pathway. This is a simplified version of it, okay? It's so simplified, this is what I show doctors too, all right? You don't need to memorize this, it's just to understand it, okay? That these are the enzymes that take arachidonic acid and turn it into leukotriene B4, thromboxane E2, prostaglandin E2. These are different parts of the inflammatory immune system, right? Now, these are necessary to do a job like kill viruses and things, but if you increase arachidonic acid too high, then it accelerates the action of these enzymes. And when you do that, it accelerates the byproducts, these resulting products. Now, what does that mean? Well, for example, 5-LOX. 5-LOX is required it's a growth factor that helps cells grow. But what do you do if you get too much cell growth? You get cancer, right? Now, leukotriene B4, right? Also involved in this pathway, as well as in creating inflammation as needed to help deal with things. It's also involved in the state of your arteries. Well, if you get too much leukotriene B4, you get inflammatory bowel disease and asthma and heart attacks and inflammation and arthritis. So if you have too much of this, you're going to have too much of this and this. If you have any of this, you might be having too much of that, right? COX-1, ever heard of a COX-1 inhibitor? COX-1 inhibitors are there because COX-1 is involved in clotting. Clotting's important, or else if you had a paper cut, you would bleed to death, all right? So if you don't want to bleed to death, you need to be able to form clots. But if you have too much arachidonic acid, you'll make too much of this, which means what? You're going to have too much blood clots, heart attacks, and strokes, okay? COX-2 is necessary for blood supply, right? Increasing blood supply. That's necessary. Right? If you do have a heart attack, you want to be able to create vasculature to create more blood supply to the areas of the heart that's damaged. But what happens if you do have too much of this? You can increase the blood supply to cancer cells, and you can have more cancer, all right? Prostaglandin E2 involved in many, many different things, but especially bowel health and pain pathways. And what happens when you have too much of this? Cancer, irritable bowel, inflammatory bowel disease, etc. So if the majority of people in our society are dying from this stuff or suffering from this stuff. And it's because of too much of this stuff. Makes sense, right? Science should make sense. And it does. It always does, right? Now, the rest of it is about how to get better. And I don't want you to just be nourished. I want you to be hypernourished. What is hypernourishment? It's an intentional overdose in the nutrition that your body uses to repair damage. That's what it does, right? So how do you hypernourish? I'll show you. Number one. All right. I feel like so I've been listening to more Backstreet Boys and stuff now because they came out with some really good music. And so just now when I said that, I heard step one, we can have lots of fun. But here we go. We're going to have lots of fun with raw vegetables, specifically cruciferous. There's other stuff in here. But as I mentioned, cruciferous vegetables, they have things like sulforaphane, right? That is anti-cancer, anti-disease. But we don't want to break things apart. We want to use them as a whole. They are the richest sources of vitamins and minerals and other phytonutrients your body uses to repair damage. So if you can make the majority of your diet come from that, you will have a rapid state of healing, which is what I've just been showing you, right? So the other thing that's important, why is it raw? Well, the studies have shown what I've been teaching for a while. It just works, okay? So I've been doing this for a long time. We tried cooked vegetables and we didn't get that same response. We got people to get better, but they didn't have full reversal of their illnesses. They didn't get that awesome energy that lets me talk 100 miles an hour, right? They didn't get that. So now they're starting to do studies that show some of the reasons. So for example, that sulforaphane I talked about that kills cancer right there in the Petri dish, that makes sure that COVID can't replicate, is totally destroyed when you cook it. Oh, well, that helps you understand some of it, right? They found that you're going to kill that off completely, right? All the protective effects that were seen were removed that we just talked about, right? Same thing with cancer. Remember, sulforaphane matters. And if you kill that off, you're already getting rid of some of those benefits that matter. Also, prostaglandin E2 significantly reduced after consuming raw kale. Remember prostaglandin E2? Look at it over here. Most of the people I see with Crohn's disease and ulcerative colitis don't have any symptoms and have reversed their labs, usually within about 5 weeks. Why? And meanwhile, people who have inflammatory bowel disease are told to avoid cruciferous, avoid raw vegetables, eat low FODMAP. What are they doing when they eat low FODMAP? They're staying sick and getting sicker, especially if that low FODMAP diet comes from this, right? Now, they've also found kale, kale is the king of the crucifers. And if you just cooked it a little bit, you reduce all the nutrient density. I know people out there try to say, oh, it's easier to digest, blah, blah, blah. That's if your gut is weak. Your gut can catch up. And I do help people with weak guts get themselves slowly onto a program where they can fully hypernourish. But if you avoid eating this stuff, your gut only gets weaker and you're malnourished. You're not going to get the benefits you get from the raw. Anti-cancer, anti-disease, and recovery. All right. The clinical results also prove it. The results I just showed you, those kind of results don't come from eating other plant-based diets that are cooked. It's why people often come to me when they have not gotten results there, including plant-based doctors and athletes that I've worked with. Okay. So the results prove it. And that's what matters. All I care about is that you get the results. Now, step 2. All right. Really it's step 5, but it's step 2 of hypernourishment is your water intake. You know, water has such a critical role in maintaining the normal function of your body. It is essential. And I meet people constantly that don't drink any water or they just have tea or whatever. It doesn't work. And even mild dehydration directly has effects on cognitive function, exercise performance, your ability to think clearly. All right. It's a leading cause of headache, constipation, low energy. Oh my. How much does the drug companies make off of this alone? And the energy drinks, right? And just drinking enough water is shown to increase your metabolic rate. You want to burn fat, you're not going to do it when you're dehydrated, but you can do it really well when you're hydrated. So for most folks, we have found 96 ounces for an adult who's at least 95 pounds. That's going to be the minimum amount that you're going to need to create that fast metabolism. And even mild dehydration damages cellular membranes and causes cell death. Everybody always starts drinking their water as soon as I start showing this slide. All right. And most people just do not drink enough. All right. And that's doctors too. A lot of these slides you're looking at now that have more heavy science on it is because I created this for a wellness program for an organization that does medical care and insurance. Okay. So it was an entire doctor audience. I'm like, you know what? I'm going to show the same slides to the general public. So most doctors don't drink enough either. And they're also mostly sick as well. Right. Most common cause of kidney stones is dehydration. It also causes UTIs. It also causes high blood pressure. It also is associated with more strokes, is being dehydrated. Fatal coronary disease, dental disease. All right. I've had so many people in my rapid recovery group who had their gum disease reversed. There's someone in my group right now who in the week 5 live meeting said she was supposed to have a tooth removed because it was falling out. And she went to the doctor, her gums reformed around the tooth. It no longer is loose, no longer needs to be removed. Her gums reformed in 5 weeks. Okay. And diabetes. Diabetes, this ketoacidosis from diabetes, gallstones, mitral valve prolapse, glaucoma. All right. And even different kinds of lung diseases, all have been associated with dehydration. All of these that people don't normally even think about. I am constantly trying to get people to drink water. And I'm constantly I made these 2 slides on water for the doctors. Please tell your patients to drink water. All right. And then finally, oh my gosh, so many people in the plant world are fat phobic. Why? Because the original studies done were on no fat versus animal fat. Guess what? No fat's better. But if you're missing omega-3 fatty acids, you will not be able to get a full recovery. You will not get a fast metabolism, and you will damage your brain's ability to function properly in terms of mood and memory. Okay. So omega-3s are the good fat. They're the good fat. All right. So I use flax seeds and chia seeds. Listen, there's minimal amounts, like most animals get them in leafy greens, but if you've been eating all the wrong stuff, the ratio of 3 to 6 is just too hard to get to without really loading yourself up on omega-3s. And what we found is the higher the omega-3, the better in terms of results, metabolism, fat loss. Yes, omega-3s cannot become body fat. If anyone tells you otherwise, they don't know the science, right? Omega-3s cannot become body fat, but they do become part of your cell membranes. They do make a big difference. I know when I added omega-3s, my joint pain just went away. Okay, so flax and chia works. If you get too bloated, cold pressed flax oil works too. And even though it's an oil, it does not create inflammation. It's okay, I promise. We've practiced on thousands. All right. So if you're just getting started, a handful a day is a great idea. If you're sick, I usually recommend about ½ cup a day or a couple tablespoons of the flax oil. And they are directly anti-inflammatory. All right. I'll show you how in a moment. They integrate into cell membranes. If you're eating all that omega-6, like arachidonic acid, you get these rigid cell membranes. Nutrients can't get in, toxins can't get out, and that's illness. Okay. You add high doses of omega-3, they incorporate and make a nice flexible membrane, and nutrients get in, toxins get out. Perfect. That's how it's supposed to work. All right. Now, they're also the building blocks of healthy neurons and brain cells. They should be the primary fat around all your neurons, but you cannot make omega-3s. You can only consume them. You have memory issues, you have mood issues. It's really important. Anti-aging, definitely. All right. Very protective against, they've shown studies that not only DHA, but ALA, which comes from flax seeds directly, are protective in brain function. And so I can show you the immune part of it, because that's why I'm here, but I always overshare, is creating anti-inflammatory immune cells. So I'm going to show you the opposite of the pathway I showed you earlier, right? Which is that your flax seeds are going to create the anti-inflammatory immune pathway. So you take ALA, and delta-6 desaturase is the enzyme. And if we do all this, what we get is your anti-inflammatory pathway, okay? These are anti-inflammatory. These are going to bring your immune system back down to normal and your body back down to normal, right? So prostaglandin E3, leukotriene B5, these are just parts of the immune system, all right? So this is how I hack people's health. And I told you, my husband used to be a computer science guy before he got into the health world. So I like to think of it as hacking. This is one of the reasons, besides all the things I just taught you about cruciferous vegetables and water, one of the reasons why our protocol works so rapidly. So remember this that I showed you earlier. This is the omega-3 pathway. Here's the issue, is that both ALA and LA require delta-6 desaturase enzyme in order to break these products down, right? So in order to create this and in order to create that, you need this enzyme. And for some reason, nobody has the answer. It prefers this pathway. So if you're still eating vegetable oils, animal fats, processed foods, then you're still getting a significant amount of this right here. And that's going to prevent this from doing its job here. And that is why the very, very old information that people still will spout, all right, is that you cannot effectively break down ALA into anti-inflammatory immune cells. They were testing that in people who ate meat. But if you remove these items from your diet, that leaves this enzyme to just work this pathway. And it works very well. And we know this because inflammation comes down rapidly. Okay. Now, the other cool thing is that just having extra EPA in your system actually inhibits arachidonic acid from being broken down, so that people don't have, I just got, I must have given a little too much smoothie to my slideshow. It just got all excited. So it inhibits the breakdown of arachidonic acid. So that's a good thing. So it decreases inflammation directly here and indirectly here. So that is what I want you to understand. So how do you do this? How do you make this all get in? One idea is hyper-nourishing meals. That new book I told you about. First of all, thank you for all of you who already got it and have given all the 5-star reviews. I knew if I did not give you a good recipe book, I'd be canceled because everybody was so excited about it. Every single recipe in Goodbye Lupus, Hello Delicious was written by either myself or someone who healed in my program. It's the first recipe book I'm aware of that's entirely a book of recipes that actually healed real people. I think that's pretty cool. The only exception are the recipes for my son Alex, who never would have existed without these foods. So he loves to make raw desserts, and so his desserts are in there. But these are just some of the recipes from that. And if you prefer to eat your food, more power to you. All of them are super simple, easy to make, same ingredients. It's cruciferous, hidden in different ways. Right? But super easy to make, and lots of dressings and desserts and all the things that people like. So that's one way you can do it. Or you can just eat salad. I mean, you don't need to do it this way. This is just showing you how exciting it can be to hypernourish, right? Or the easiest thing that we've been teaching forever is a smoothie solution. Just take cruciferous vegetables, shove them into a high-powered blender, throw in your handful of flaxseed chia, put in enough fruit to make it taste good, put in water and blend it. Now you've got water, cruciferous vegetables, and omega-3s, and you can drink it through a straw. Okay. And we give our recipes away for free. This is one of my, this is a website that my husband made. It's called smoothieshred.com. If you go to smoothieshred.com, we have free recipes and videos. You do not even need to enter your email address. It's not one of those fake things where it's like, oh, it's free. And then you show up and you're like, oh, I only got like 3/4. Now I need to like be on a spam list. We don't even know your email address. You can go there, look at everything for free. And then if you want to, there's a link at smoothieshred.com to join our free Facebook community too. Also free. Just if you want to like hang out on Facebook with other people who also trying to do the same diet. And so you can take a screenshot of this. This is one of our daily drinkers, but we have a lot of free recipes and things. Like I said, I've always been about giving in public service. Even now, if you follow me online, Goodbye Lupus on Instagram, Facebook, YouTube, I do free Q&As for the public and free coaching for the public every Wednesday, 12:30 p.m. Pacific. So if you want to write that down, 12:30 p.m. Pacific, every Wednesday, I just come on live on all of my social media to answer questions and coach people. And I've had people send me messages that they literally healed just from that, from Smoothie Shred, my books, free coaching online, and they're healed of their diseases from MS, rheumatoid arthritis, and other diseases. It's actually amazing, and it makes me happy. I promise if everybody heals off my free content, I will be okay, and I will be happy, and maybe even take some more time off. So make sure you check that out if you're looking for free stuff, free recipes. We have so much content for you guys that we donate to the public, and there's no catch, just so you know. Practical tips to get started. So I always like to end a presentation with people having the ability to actually begin, not like, oh, that was inspiring, I still have no idea what to do. So number one, have what you're missing. All right. For many folks, they get rid of the animal products and then they're just eating rice and beans. That's not going to work for disease reversal, not if you want to get to optimal. Okay. A lot of folks feel a lot better, but you want that optimal energy. You want to not get sick. You want to look 20 years younger. I'm telling you, this is the way. Okay. So adding what you're missing, literally, if you add smoothies and hypernourishment to your current diet, you will already start to build energy. You will start to repair damage to cells, and you will feel a lot better. We just had someone post into our Smoothie Shred Facebook group that her husband told their neighbor about my protocol. The only thing they did was add hypernourishment. They didn't even all go plant-based. They added the hypernourishment smoothies, and her autoimmune antibodies went away. That just by adding what she was missing. Most people need to be more aggressive than that, but literally that can make that difference. One, it's going to crowd out what you're eating that's making you sicker. So that's good, right? If you have to drink a smoothie before every meal, you'll eat less of the crap, and your body will have the ingredients it needs to start really making a difference. All right. Number two is just start. Don't wait for like New Year's or anything like that. I'm telling you, It's worth it to start now. It breaks my heart when I see people and they're like, oh, I was waiting to see you to start. And then I asked them what they ate like right before the session. And the last person I talked to was chicken Parmesan. And she's in kidney failure with 13% of her kidney left. So whatever it is that you can do today, just start today. Today, before you go to sleep, what can you do today? Can you eat an apple instead of a cookie? Can you add smoothie? Can you add nourishment in some way where you can get started and actually start making a difference in your health? You need to do it. You need to just start. What I find is most people who don't start, they're thinking, I just need a little more information. I'll just watch some more conferences online. I'll read more books, but they're not actually taking action. It's not the reading and information that heals you. It's taking the action that heals you. So just start where you can today, right now, okay? Even if for you starting is just starting to have the conversation with your family, all right? The next thing is all about mindset. My book, Goodbye Autoimmune Disease, is actually not only the case studies of reversing autoimmune diseases of many different kinds, because my first book, Goodbye Lupus, is the nutrition plan and my story. Goodbye Autoimmune Disease has all these case studies and testimonials of other people, but the majority of that book is the mindset. Because what I've learned over time, especially doing the work that I do, is that trauma, depression, anxiety create inflammation that can combat even the best diet. And so what I do in rapid recovery is not only optimize their nutrition, but I optimize mindset. I teach them how to be present the way I learned to be happy and grateful through trauma. You can experience trauma and not be traumatized. I can tell you that from personal experience. But you have to be able to celebrate what's good in your life every day and focus on passion and purpose, right? So celebrating every win is important. That was me actually in a Zoom session with someone where I was so excited about our labs, I had to show up with my hat on, okay? Celebrate every single thing that's going well. So many people I see, they're so focused on what's wrong that they forget what's healing. I'm working with someone in my rapid recovery group right now. Her labs show that her thyroid is healed. Her joint pain is gone. And this is at 5 weeks. And she's still afraid she can't heal. And I said, but you've just proven to yourself you can. That's all mindset. Whatever you're looking at is what you see. So make sure you're looking for gratitude. Make sure you're looking for celebration. What you look for is what you see. If you're looking for beauty, you can always find it. And if you're looking for suffering, it's there. Life will get you. And if you only look at what's negative and where the suffering is, you will feel like you're losing. And I want you to all feel like you're winning, okay? And finally, well, not finally, second to finally, focus on your why, your reason. Raising my family has always been a very important thing. I want to grow old. This is us renewing our vows, by the way, at our 10-year anniversary. But, you know, I want to grow old with the person I love. I want to see my son graduate high school. I want to see him get married. I want to be a grandmother. I want to be a grandmother who can outrun her grandkids. But also, you're my why. Every person who's sick, every person who hurts is my why. And so I will always be here and doing this work and keep my health going, because my health is not just for me and for my family, but it's so I can be a role model for you, right? How many people out there are teaching health and you can visibly see that they are sick, overweight, their skin's kind of pale, right? You know, they don't look very nourished. They're not looking too good. You're like, oh, you know, like, no, I know I have to be there as that role model to show you the way and to continuously give you hope. And so I will always take care of myself for my husband, for my family, and for you. What's your why? What is important enough to you that you're willing to put aside the stuff you like to eat, that you're addicted to eating, that you're willing to put that aside so that you can instead focus on what you want to achieve? Because eventually the cravings go away if you give them up. But the only reason you give them up is because what you're creating for yourself is so much more important to you. And the other one is to find a community, right? So we created our Smoothie Shred Facebook group so that we could create a free community for people. Some people really need to heal faster and they do rapid recovery in my rapid recovery group, and they're in a small community of people who are all healing at the fastest rate possible with the maximum level of support. Maybe you have a community in your town. Maybe you can start one. Maybe you go to meetup.com and you join plant-based meetup groups. People will always end up giving into their environment. Create an environment, find an environment that supports you winning. It is so important, okay? And make sure you have fun with it. Like, this doesn't have to be torture. This doesn't have to be like, oh, first I'm sick and now I have to eat vegetables. Enjoy your life. Enjoy your life. Enjoy the gifts you have. Enjoy your family, okay? And have fun with it. That's the most important thing. All right. So I'm going to put up this last slide so that you can take a screenshot. Thank you so much for all your time and attention. I wanted to leave time for questions, but make sure you check that out. There's my email address. That's my cell phone number. That's my actual cell phone number. If you have a question, text me. Okay. I'm here. And if you want to come to my free Q&As, if you want to learn from me, I'm always online. Goodbye Lupus, IG, Facebook, and YouTube. I'm prolific at it in support of you and your recovery and your health. Because like I said, I'm on a mission. I'm on a mission to try to help as many people as I can get well. And so if I could be a part of your health, your recovery in any way, I'm trying to be there for you. So thank you for your attention today. And I hope that this made a difference and helped you kind of connect some dots and got you motivated to start taking care of yourself, for you, for everybody else out there who needs to hear your gifts.
Great. Thank you so much, Doctor, for all the information that you shared.
You're welcome.
So we're now going to formally begin our Q&A session. For the audience who wants to ask a question of Dr. Goldner, please raise your hand in Zoom. If you're not familiar with how to do that, we're going to post how to do that in the chat. It's there right now. We don't take questions from the chat, so please raise your hand if you would like to ask Dr. Goldner a question. So is the protocol that you suggest for that you use personally and you suggest for most people, is it the same for everyone and for all autoimmune diseases, or does that have to be tailored ever?
So the structure is the same, right? Because my protocol is not specific to autoimmune disease or any specific disease. It's specific to cellular health, cellular function, cellular recovery. And we're made of cells. Our cells have differentiated into different organs and systems. But when it comes to cellular repair and cellular function, the nutrients that you need are the same. The tailoring I do, because I do tailoring for folks. As I said, we've had people from all over the world heal for free, just taking what I just taught and putting it into action, right? And that's what I want. That's what I want. But there are folks who will meet with me for tailoring. The reasons, number one, is because they need help with the emotional side of it, right? I mean, for a lot of folks, it's not an information problem. It's about addiction. It's about emotional support. It's about self-sabotage and depression and other things. So sometimes they need my help in tailoring the rest of their life, teaching them self-care, helping them as I do my group, download my positivity, as they say, so that they can change their life. The other things about nutrition that can be tailored, helped a lot of people reverse inflammatory bowel diseases. They often can't start with full hypernourishment. They're bleeding out of their rectum. So I often need to start where they are and help them heal that in order they can get to the point where they can actually have the high dosage of raw vegetables. For people with kidney failure, I've helped many people reverse kidney failure, get off dialysis, get off the transplant list. So those folks, they often need tailoring because the kidneys are responsible for filtering nutrients. So you can have potassium buildup or sodium wasting or things like that. So I have to tailor the ingredients of how much they can eat of those same foods, which ones they can have without disrupting their blood tests, right? So I will tailor it for them. So with kidney failure, especially, I often will have to make changes and encourage people to see me so that we can make sure that they can heal without having their lab markers go wild because of the potassium intake, for example. So those are the biggest reasons, is some kind of organ dysfunction. Sometimes it's medication related because of the medicine, they can't do it. Other thing would be things like allergies. Some people have histamine issues, especially since COVID. Some people have food sensitivities and allergies. Sometimes they don't know what their food sensitivity is. They just know that something is triggering me. That's another thing we do in rapid recovery when we watch people every day is like, okay, if we don't see what we're expecting to see, you might have a food sensitivity. And so I have different methods of testing them. So that's where the tailoring lies. It's really for those specific kinds of examples. But in terms of the types of nutrients people need, it's the same. That's why I always say, if someone's telling you there's a different, like this is the kidney diet and this is the lung diet, and this is the brain diet. No, I mean, there is an optimal way for humans to get the nutrition they need. It's just that once the organs start to function abnormally or the immune system's functioning abnormally, then we have to tailor things just because of what you can tolerate or what can trigger you.
Great. And how does this protocol help with mental health?
Oh, goodness. So there's many different ways. So it depends on which part of the protocol you're talking about. So the Goodbye Lupus protocol is just about the nutrition, right? And it's called Goodbye Lupus because of my story. But again, the nutrition is for cellular repair. So the nutrition itself makes a big difference. I mean, what you eat affects all of your organs, and your brain is an organ, right? So if you want your brain to function normally, as I pointed out in my slideshow, hydration affects brain function and cognition. and so does nutrition. So does omega-3 fatty acids, been shown to affect memory, brain function. Also, studies have been shown where omega-3 fatty acids can help stabilize moods in people with bipolar disease, have been shown to work like medication for ADHD. So the nutrition is a very important part of your mental health and brain health. Also, though, as I mentioned, the other part of it is, when I talk about Goodbye Autoimmune Protocol, then I'm talking about also the mental health side of it in terms of what you do. So your mental health comes from your nutrition, your sleep levels, and also your thoughts, right? And so what you do, your behaviors, your thoughts, all of those feed back into your moods. And so I do a lot of work with people on helping them understand how what they are doing over the course of their day is affecting their mental health. I just met with somebody who, I was talking to her about, I said, I just don't think I want you to get out and do more. You're isolated at home. And I think because you're isolated, your moods are low. And I think you'll heal much faster if you get out. And she's like, I'm just busy eating all day. I can't get out. I said, really? So I did the math with her, took out my pen, old fashioned. I said, how many hours are you sleeping? How much time does it take you to make a smoothie? She said an hour. It takes 5 minutes, but she said she goes through every piece of lettuce or spinach to make sure there's no bugs. Fine. I said, give me the max time. Hour. Fine. How much time to make your salad? Turns out she spends 15 hours a day free. So I said, what are you doing for 15 hours? Eating. I said, well, hold on. You're sitting at the table eating for 15 hours, like using your tears as dressing? What are you doing? Watching TV. Now I know what you're doing for 15 hours. You're eating in front of the TV. Because I said, I also eat all day. But you know what I'm doing? I'm teaching, I'm working, I'm healing people. Am I also eating? Yes, but I'm not. I would never say I'm drinking, but I'd never say I'm eating all day, right? So a lot of times people don't even realize what they're doing and how it's impacting their moods. And as I started this whole talk with, how you live your life has a greater impact on your quality of life than your actual physical health does. So I spend so much time on that. That's why I start with that and end with that, if you notice, is about purpose, passion, what you do. We don't get to choose how we feel when we wake up every day, but we choose what we focus on and what we do. And I don't ever want anyone to miss a day because they're so focused on, I need to feel everything working properly in order to live. If you live, you won't even notice what hurts in the same way. So all of those things combine to create your mental health.
Great. So energy is obviously a huge thing for people. Two questions here. One, were you always so energetic? And two, what kind of changes can people see in their energy levels by changing their diet to this hypernutrition?
So I am fueled by smoothies. And, I showed Julie, who's like, her doctor texted her, didn't you used to be hypothyroid? Her goal when she did rapid recovery with me was, I want Dr. G energy. And by the end of 4 weeks, she had good energy and was able to go back to work. But she said a month later, she had Dr. G energy, started 2 new businesses. She does all this other stuff. Like, she's like, I can't stop. Like, I'm running. Like, I just, so I actually had a guy, this was funny. I had a guy who came to me because he had high PSA for his prostate was inflamed. And he wanted to see what he could do nutritionally to bring that down. And it worked. We got him on this full Goodbye Autoimmune protocol, and his PSA markers dropped like somebody slapped it, just bam, coming down. So he makes a follow-up with me. And I was like, man, why are you here? Your labs look great. What are you seeing me for? And he goes, I need your help with energy. I said, what's wrong? He goes, I have too much. He goes, I don't like to exercise. I just want to be able, I'm retired. I just want to be able to sit on my couch and relax. But I have so much energy, it makes me want to just drop and do push-ups. And I don't want to exercise. So I need your help with less energy. I was like, get out of here. What are you talking about, man? No, I'm not going to malnourish you so you can sit on your couch. You go for that walk and you do those push-ups, So it was the funniest thing. I was like, most people want the energy. And this guy's like, I want to be sedentary. Please make me stop wanting to exercise. It was the funniest thing, true story. So your energy is directly related to how nourished you are and how hydrated you are. And I'm very nourished and hydrated, and I have been for a long time. It's interesting because I'm mostly raw. I'll eat some cooked food at dinner. And as soon as I eat dinner, it comes down like 4 notches. Now I can watch a show on Netflix. So if I have a smoothie, I start thinking about writing another book. Now, I don't need that at like late at night. But if I have cooked food, oof, I feel the energy come down. And so it's like normal person energy, but it's not as fun. So it's one of the biggest breakthroughs people usually find. The other thing that can drain energy is anxiety. Anxiety is like being a hamster on a wheel. You know how they're going full speed, but going nowhere? They exhaust themselves going nowhere. And so some folks will say, like most folks, when they do the nutrition, they're like, oh my God, this is amazing. People who are sick have better energy and feel better after getting sick and doing my program and recovering than they did before they were sick because of the nourishment, right? But the folks who struggle with energy are usually the ones with depression and anxiety because they are so exhausted by the mental struggle. And so that's the other thing to be aware of. And again, that's why I work with people on all of it together, the mental and nutrition. But yeah, I know it's I'm a lot at all times. My husband says I'm a lot, but he loves it, you know. So this is me full time.
So you talked about hydration as being important, and I think a lot of people overthink this, but what are your thoughts on water filtration and structured water? Is there anything to that, or just get the water in your body? What are your thoughts on that?
Just get the water in your body. I actually prefer people don't do things like distilled unless their doctor told them to. But when I was healing, I know everyone's going to just be horrified. They're going to leave the Zoom meeting. I would drink out of the tap in the sink at the hospital. Like I just needed to fill my gallon jug. What I found is dehydration is causing problems. So yes, I had read about microplastics and and the fluoride and all the lions and tigers and bears. I've read all that, but what I've seen in practice, and I'm results based. Everything I do is based off results. If it works, I keep doing it. If it doesn't, it's gone. And that's why my protocol is so simple, right? So what we found is that when people are dehydrated, they stay sick and they stay tired and they stay fatter. And then when they're hydrated, everything gets better. So I have never seen where someone's like, oh, I got healthier and then microplastic overdose. I've never seen that yet. And there are thousands of people in my Smoothie Shred group. There's thousands of people I've worked with personally at this point. So I haven't seen there be a problem except for dehydration. Same thing with like organic versus not organic in terms of produce. I couldn't afford organic. I was an intern making $30,000 a year living in Los Angeles. I couldn't even afford my own studio without my husband. He was my fiance at the time, helping me pay my rent. So whatever veggies I could get is what I ate, and I still healed. So I've had people who are on welfare do my protocol off of my free content, healed. There was a lady named Kim. I have pictures of her that she let me share online. Healed from being in a wheelchair to fully active and lupus free off of my free content on welfare, just eating what she could get. So it's just about getting what you need in there.
And you briefly mentioned coffee and tea with regard to hydration. Can you repeat what you said on coffee and tea?
It's okay to have coffee and tea. It's just that for some people, that's the only thing they drink. So I don't count that towards hydration. And if it's caffeinated, then you're actually dehydrating yourself a bit. But water matters. People are always looking for something like, oh, I heard this one kind of tea could be anti-inflammatory. Maybe, I don't know. I've never seen anyone cured by tea. That would be so much easier than doing all the stuff I'm doing. So if you want tea, have tea, but don't forget the water intake. It is essential for your body to function. You should be like the earth, mostly water. All right. And people have forgotten that. And it's one of the reasons why people can't finish their recovery. They can't get better, is because they're just so dehydrated.
And how does the conventional medical community respond to your results? How do they explain it? How do your colleagues perceive what you do and what you suggest to your patients?
Really enthusiastically, actually. I have not had any pushback because I can show the results and I can teach the science. So I was so sad it got canceled. I was supposed to be the keynote speaker for Kaiser Permanente's wellness event, but it was in the Lake Tahoe mountains, right when they had that snow blizzard. I don't know if you remember, there was like a thunder blizzard. That's where I was supposed to teach that weekend. So I got canceled, but there was going to be 400 doctors there. And they invited me to be their wellness keynote because of how good what I'm teaching is, like in terms of the science and the results. And in a place like that, they are in charge of the, they own both the hospital and the insurance company, right? So when you're the insurance company, you want people to be better because you have to pay for that hospitalization. And so they are actually, I wish all insurance companies also own the hospital because they make money when the hospital's empty, right? Most hospitals only make money when beds are full, right? So that was something. So in the community at large, yeah, I've actually gotten great results. Like I said, I have a lot of doctors that I work with, pharmaceutical researchers, nurses, all sorts of, like they can tell when I get down and dirty with the science that I know I'm talking about, and the results are amazing. So yeah, I really have had wonderful, wonderful interactions. I remember once I was teaching actually at Kaiser, And there was a resident there who sat like this through all my presentation. And I was thinking, okay, this guy's just not listening. And at the end, he came up to me and he goes, I came in here just like annoyed I had to come, and you won me over. I'm really, really excited and interested. I've also had medical schools from around the country and actually other countries invite me to give like Zoom presentations. So the medical students are very excited as well. Thankfully, they use the internet. They're learning things that are not being taught in their medical school, unlike people like me who had to only learn what we were taught unless we tripped and fell face first into a smoothie and got to learn some other way. So I've gotten amazing acceptance. Even things like Forbes. I'm the first plant-based doctor in the Forbes Health Advisory Board. And they send me articles all the time asking for my information and support. So yeah, it's been awesome. It's been absolutely awesome.
And do you find that medical schools are getting better with regard to nutrition, or is that still status quo?
I don't know. I mean, I'm not in medical school. I just celebrated my 20-year, my 20 years. I didn't go all the way to Philly for it, but I celebrated in my mind. Thank goodness, 20 years since I've had to go to medical school. What I do know is the medical students are better. I don't know what the education is like, but I do know that the medical students themselves are asking for me to teach them. And so they have their own groups and they're creating their own little meetups and conferences and inviting their own speakers. It's the coolest thing. So yeah, I've taught at medical schools where the students were the ones who invited me.
And over the 20 years that you've been doing this, how has it changed with regard to medical students' interest and doctors' interest? Has it gotten better?
Oh, absolutely. I mean, when I first even posted something about my lupus and everything, while there was also a lot of interest, there's also people like, what? You can't reverse autoimmune disease, blah, 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 all this stuff. That was a while ago. Let me see, I published about lupus in 2015. So this is a little bit ago, almost 10 years ago. Now, if I post anything, I never get pushback like that. In fact, if some stranger wanders in somehow and says anything negative, they get like 10 people immediately will reply and go, nope, because of her, my lupus is gone, my RA is gone, this is gone, that's gone, my allergies gone. I don't have to do a thing. Like, it's just like, it's just totally, like it's spread so much that it's just like, you can't refute it anymore. You can't refute it. It's just, and the truth always gets out. Look at the name of this conference. Like, the truth cannot be suppressed. It will eventually make itself known. And the thing is, I've been doing this a long time. If what I was teaching wasn't true, I'd be long canceled. It's just the case. Like, what we're teaching, it works and people's lives are better for it. And so whether you're a medical student or a doctor or someone from the public who's just looking for answers, the answers are here and it works. And my hardest job is convincing people to try it. That's it. Because once they do it, they get better. It's just the convincing of the trying. That's what I'm doing right now. Is just do it.
Great. I'm going to throw it out to the audience for a few questions. Kat G.
Hey, Steven. Just want to say hi to my shredder.
Sure. Please state where you're from, Kat, and ask your question.
Hi, Dr. Brooke. I'm from Virginia.
Let's see. Hi.
I'm from Virginia, and I'm so glad I found you. I've been following you for several weeks now. You bought your books and your husband's book and on your Facebook page. I've been doing the smoothies and water and omega-3s for a few weeks now, so I keep learning a lot. My questions, I have two. I have hypothyroidism. I'm on Armour, 30 milligrams. And I'm wondering how soon to keep rechecking with blood tests. Can it actually be eliminated and get off all medication? My second question is, and I've been hypothyroidism for like 10 years maybe. My second question is, I'm doing a lot of kale, cabbage, flax, avocado in the smoothies, as well as salad meals. And I love them. They're delicious. But I'm wondering if I got a histamine issue, because my eyes, like just the last couple of weeks, my eyes just keep tearing and won't stop. And so I'm wondering, am I overdoing too much? I'm not sure it's from that. I'm just wondering if it's a sensitivity or something. And will that eventually go away if I continue, which I plan to do?
So first of all, I'm so glad that you're on this journey. That's really cool. I'm happy for you. Number one, in terms of thyroid, usually when people have thyroid issues, the most common reason that they get their labs checked is because they have hypothyroid, but suddenly they're jittery. They have all the symptoms of hyper. So maybe they're getting stomach cramps, they're sweating, their energy's kind of jittery. And so all of a sudden, like, get that lab test done. And what they'll find is their TSH will have come down a couple points and now they're hyperthyroid, not because there's something wrong with them, but because their thyroid started working again and now they're taking too much medicine. So oftentimes that is the reason people will test. Other than that, you could test it like every 6 weeks or so just to see where it's heading. Right now in our rapid recovery group, we're at week 5. So a lot of people are getting labs done because they want them to be done before the end of the group. And we've already had a couple people test and their thyroid dramatically has improved. Thyroid antibodies already almost gone. I mean, it's the coolest thing. So it's up to you how often you want to test it. Watery eyes, don't Google. Like there's no reason to think because you have watery eyes, you have a histamine issue. I think histamine issues have been very oversold. It's just one of those things where it's like now everyone thinks they have it. It's not always the case. Typically watery eyes have to do with what's ever going on environmentally. So if the heat is on or if there's like pollen in there, it is getting springtime here. So it could be a reaction to pollen or something else. I don't know. If it is a reaction to food, it might not be histamine though. So you can always test different kinds of foods to think so. But what I find is most folks, once they change their diet, anything that happens, they assume is their diet, even though it's not. Like there are other things that can cause your issues that have nothing to do with how much cabbage you ate. But it's an easy thing to test. If you think there's a direct connection, you can always just test out different high nutrient foods and see if you have the same reaction. But either way, I'm glad you're doing this so that you can get your health back.
Oh, me too. Thank you so much.
You're welcome.
So, what are your thoughts on supplementation? Should people be looking to supplement with all of the stuff that, all of the products that are out there? Are there dangers to doing that? And to the extent that you think that people should be supplementing, what should they be supplementing?
So typically, no, I don't think people need all these supplements. I think it's a huge industry. It's making a lot of money. That's not necessarily solving a lot of problems. I've never worked with someone where I'm like, oh, they just needed this one like random ashwagandha something and then boom, they're healed. I've just never had that happen. And I also think there's an issue nowadays where a lot of docs will kind of sell themselves as like functional medicine or holistic or even naturopathic. And then they give them, like, I talked to someone today, over $500 worth of supplements a month, and they're still equally sick. So I think that, the supplements are also, they're medications, right? They're interacting in your body and they're trying to make you feel in a way you don't feel. So there are some supplements that are necessary. Vitamin D, people's immune systems do not work properly with vitamin D. And I've been actually alarmed to hear some people say things against vitamin D supplementation. I have seen multiple people who their immune systems would not respond and their antibodies did not go away and their vitamin D was low, and we fixed the vitamin D and boom, antibodies gone. Like it has really been a problem. Or someone who was in full remission for years who had an antibody come back only when her D went low, got the D right back up, and then the antibody went away. And there's been studies in this too. So vitamin D is necessary for immune health. And most people are not getting enough. Even if you live in a sunny state, I do, it just doesn't work. I don't know who came up with that 15 minutes a day thing, but it does not work. So unless you are, as one person who tried to argue with me on Facebook once, said his vitamin D was normal, but he lives in Arizona and he sunbathes nude every day for a couple hours a day. And I was like, well, you just proved my point, because unless you will sunbathe nude for a couple hours a day in Arizona, you probably need to take D. So you can test your levels. If it's over 40, you're in a good place. If it's under that, I recommend it. And most people need to. Okay. 2, B12, even people who eat animal products often has B12 issues. And so B12 is necessary and something people should take. And again, how much you get a lab test, find out what your numbers are. That's the safest way to know your right dosage. High B12 doesn't cause issues, but low B12 absolutely does. Neurological issues, hematologic issues. But overdoing supplements causes problems too, right? B12D, definitely. Iodine, oh my God. I've been seeing so many people with thyroid issues that do not have Hashimoto's, but they have iodine deficiency because they stopped eating salt. So they were listening to people who say to stop eating salt, and they didn't even notice that that was their only source of iodine, which is necessary for thyroid and brain function. So if people aren't using iodized salt, which if you're drinking all the water, I say you need a little salt in your diet. If not, at least take an iodine supplement. So those are things that are absolutely necessary to be consumed. But I've had multiple people show up in the past 2 years with neurological diseases that were caused by B6 toxicity. Just saw one last week. And his naturopath told him to take B6 because it's associated with higher testosterone. He was trying to raise his testosterone. And I said, it's true. However, if you take more than 50 milligrams a day, you can get toxicity to your nervous system. And he had neurological issues and shaking and pulsing. So you can't just take vitamins willy-nilly and supplements and think they're not bioactive. They absolutely are. So what I usually tell people is if it's helping you, take it. If not, save your money and focus on actually getting the nourishment you need from your diet, with the exceptions I just mentioned.
So if someone feels awesome, should they look to also supplement with D, or if they're feeling awesome, they're good? Yeah,
because you can't get it from your diet unless it's supplemented. The only way you get it in your diet is someone put the supplement into their product. So you can test your levels and find out. But yes, you should make sure that you're having D and B12 in your diet and iodine.
And iodine, what sources? There's a little controversy. People say sea vegetables, seaweed, except now that the oceans are so toxic that there's a lot of chemicals and stuff in there. Should we just be using iodized salt? Should we be getting it from sea vegetables or just a supplement?
It's 99 cents for a container this big, and I've never had to worry about iodine. And because I drink a gallon of water a day, this is my second serving here of 70 ounces, right? It's fine, right? So a lot of people, they unfortunately, a lot of the research are saying, oh, avoid all sodium because it affects blood pressure, XYZ, only because they're dehydrated. If you drink enough water, you actually need the daily allowance is a teaspoon a day. And the government long ago, at least in the States, put exactly the amount of iodine we need a day, 150 micrograms, into 1 teaspoon of salt, which is also the daily allowance of salt, because they're like, cool, we get to solve 2 problems with 1 thing. But now people are doing sea salt or no salt, and then they have no iodine, and that's a problem. So which iodine source? Whichever. I mean, like I said, I'd go the cheap route. I just use iodized salt. If you want to use sea salt, then you might need an iodine supplement, and they do sell supplements. I would say if you're going to use a supplement, I like the ones that are liquid because there's less additives. So you can use one where like 1 drop is your daily allowance. Great. If you have hypothyroid, you're going to need to take more of it. Usually they need about 300 micrograms, but too much iodine is also toxic to the thyroid. So it's just one of those things where it was like we had it good for a while. And then sometimes when we're trying to teach health, it actually can be disruptive in some ways without meaning to, right? Where people are like, oh, don't eat salt with additives. And then accidentally now people are hypothyroid. So I haven't studied every type of iodine. You can get it from sea vegetables. You just have to be careful because sea vegetables are often super high. And I've seen people overdose in iodine because they were getting like 600. I just met someone who was doing like 2,000 a day. I'm like, you're supposed to be getting no more than 150 a day. Like you're going to poison your thyroid and you're going to end up with hypothyroid. So just be careful. Just so whatever source makes you do it.
Thank you. Next question.
Results.
Next question is coming from Michelle P. State where you're from and ask your question, please.
Hi, Dr. Goldner. This is Michelle from Canada, and been a longtime follower, fan. I've recommended your protocol to a lot of people. And I'm just wondering, is this safe with, well, does it work with cancer? And if you think that it will, because it is hypernourishment, if a person wanted to try it, would they have to wait until they're finished chemo?
So I always have to preface this because at least in the US, it's illegal for doctors to say anything besides FDA approved things are treatments for cancer. So that's medicines, that's surgeries, radiation, all those things. So those are the treatments. All right. Now, what I'll talk about is, can nutrition help in addition to treatments? Yes, absolutely. And the science supports it, right? Look at what I just presented. How just simply cruciferous vegetables alone can prevent cancer cells from reproducing, right? So nutrition absolutely has an impact. And I have worked with people, especially in rapid recovery, with cancer and also post-cancer. So for folks with cancer, like we had someone with prostate cancer in my rapid recovery group, and his prostate cancer marker in his bloodstream had been going up for years. And then rapid recovery, it went straight down, lowest it's ever been. since all those issues started. I've had people with visible tumor shrink. A doctor who had a tumor in her ovary disappeared within 6 weeks. Tumors coming out of skin regress. So I don't recommend nutrition instead of other treatments. I actually personally myself, if I had a tumor, I would still pursue medical treatment as well. I want any visible tumor removed. Now, I don't think I eat in a way that I could get cancer, even though the treatments I took made me more likely to get cancer, right? Because of the chemo and everything else, all that increases risk of cancer. But the way I eat is pretty anti-cancer. So how are you anti-cancer? By eating nutrients that prevent cancer cells from reproducing, and also that optimize your immune system's ability to locate and destroy, which is their job. So I have had great results in seeing people recover dramatically. As I said, I do recommend people do whatever it takes, because even like, let's say you have cancer right now, the cancer is every time it is growing exponentially, right? Because each cancer cell, they grow at much faster rates than anything else in the body. That's how you create a tumor. So as these cells increase in size, they're growing rapidly. Now you're trying to eat healthier, and you're hoping that your nutrition can get good enough, fast enough that your immune system can catch up with the rate of the cancer growth. While I have seen beautiful results, to me, that still would make me nervous enough to want surgery too, and then do my nutrition or other treatment. So that's just speaking for myself personally, is that I think that it's a whatever it takes diagnosis, but absolutely nutrition plays a huge role in whether or not you get cancer. Like, we know certain foods are carcinogenic, right? World Health Organization says that processed meats are in the same category as cigarettes, cigarette smoking, right? So, and asbestos. And then the next stage down, other meat. So we know that the reason that people get cancers has to do with diet. And so absolutely diet can increase your ability to fight and prevent it. Now, the other part of it is after treatment. So I've had a lot of people who actually have joined my rapid recovery group to recover from chemotherapy. So we've had a bunch of people who have reversed chemotherapy-induced neuropathies and brain fog. So a lot of times when people finish chemotherapy, they're cancer-free, but they feel bad. They still feel sick. They still have brain fog. They still have neuropathies, and those have gone away completely in our protocol as well. So it's helped people recover from their treatments as well. So definitely, it's definitely something that you should be doing. I think everybody should do it. I don't have any health problems and I still do it. But it definitely has a big impact on cancer, whether you get it, how well you can recover from it, and of course, recovering from treatments as well. I would do it the whole time.
Thank you. So I'm asking this question on behalf of Tamara K, who wants to know why some people have problems with oxalates. And we hear things about green leafy vegetables having oxalates, and they may be problematic for people. What are your thoughts on oxalates? Is it something that we should be concerned about in general?
No, and honestly, like, I have YouTube videos just called this that you can watch in more detail. I wrote about it in Goodbye Autoimmune Disease, but the basic answer is no. So oxalates are in vegetables, yes. But that's different than, again, this is another thing that I think has become overblown, where everyone thinks they have an issue where they don't necessarily. If oxalate issues were problematic when people eating raw vegetables, then my whole smoothie shred group and every person I've ever worked with would be dealing with stones, right? It'd be like, goodbye lupus, hello kidney stones, right? It's just not happening. So the basics are to understand the science of it. So you can have oxalates in your system and you will urinate them out. It will go away, right? Now, people who have stones, so for example, kidney stones, the most common cause of kidney stones is eating animal products and dehydration, right? I learned that in medical school. That was one of the few things I learned about that had a food cause. It was animal products and dehydration, right? And alcohol. So what they found is there was actually a study they did where they went, if the majority of kidney stones are made of oxalates, it's oxalate stones, then if we take out the foods with oxalates, they should get less stones. So they did a study and they took the vegetables away from one group of people who had kidney stones, and they got more kidney stones than ever. Why? Because the plants actually alkalinize the urine. And if you have a more alkaline urine, then you're not going to get the stones precipitating out. If you have acidic urine, those stones will precipitate out. So actually eating the vegetables, even though they have oxalates, will prevent the stones by alkalinizing your urine rather than causing the stones just because of the ingredient. So it's just a misunderstanding of the science. This ingredient's there, and therefore it must cause that. But that's not actually how it works physiologically.
And what about issues like gout? Have you had?
Yeah, I've had people recover from gout too, which is also affected by heavy meat diets, alcohol, dehydration, as well. It's very, very painful, and I've seen people recover very, very quickly. So I would say, there's a very tiny percentage of the population that if they're going to get stones no matter what, in which case maybe limiting oxalate intake could help, but even then they still need their nutrition. So usually for them, I'm just like, just avoid the spinach and like beet greens and chard, but really you still need nourishment. I'll give you an example. My husband got kidney stones before I met him, and he ate pretty clean, but he ate a lot of meat. And even though he was super hydrated, he got multiple kidney stones. The moment he switched to doing it all plant-based, he has never had another kidney stone in 20 years.
Wow. All right. Next question is from Aruna S. Please state where you're from and ask your question, Aruna.
Hi, this is Aruna from Maryland. Thank you, Dr. G, for your service. So how many ounces of green smoothies should we drink every day to get the result? And can adding cooked beans cause inflammation?
Okay, so it doesn't matter how many ounces of smoothie you have. It's really about how much greens you have, right? Because you could make a smoothie where you put like a little bit of greens, a bunch of fruit, and then blend it all up, and you have 100 ounces of smoothie, but it's barely any greens, right? So what the smoothie is just a delivery system for the greens. So if you're trying to get better health, I recommend you do about 1 pound a day of the raw cruciferous. You can also add spinach. It can hang out with the cruciferous, but I do recommend you still get cruciferous because of that sulforaphane and other good nutrients. But about 1 pound a day of those raw vegetables is going to make the difference. You can put that all in your blender if you want, or you can put half in the blender and put the other half in a salad, right? You can have more, but it's really not about how much smoothie. It's just about how much of the vegetables you're getting. The smoothie is just a delivery system. In terms of beans, so that depends on your health, right? So for a lot of folks, adding hypernourishment to a plant-based diet, they already get all the results they need. Beans aren't adding anything. And I know that's something that's controversial. I don't think it should be, but like there are some folks who are like, you need to have beans. But scientifically speaking, I have never once had a client who could not reverse their disease unless we added beans, but I've had many clients that could not reverse their disease until we took out the cooked food. So that's what matters to me. It's all about the results. Like I care more about results than anything else. There's no ego in it for me. It's just about results. And if I learn something different, I change what I do. And so for many people, if they're already pretty healthy, if they get all their hypernourishment in and eat a little bit of beans and cooked vegetables, they still get their results and they're healthy. If they're actively trying to reverse a disease and they're not getting the result, take it out and just go all in on the Goodbye Autoimmune protocol, get your results. And then when you add the beans back, usually it's just fine. When they add the beans back, they can maintain it. And so the maintenance diet is pretty simple, right? Keep all the hypernourishment in, add back other cooked plant foods, and enjoy your life, right? So yeah, I've seen it interfere with recovery in some people, but I don't see it to be a problem in maintenance. But again, it's really up to you. Not everyone needs to eat only raw in order to get better. For many people, just adding the nutrients they're missing was the missing piece.
So we have about a minute left, and
Okay.
you said something that so we just have a brief moment. You said something to the effect of, if you learn something different, then you change what you do. What have you learned different in the time that you've been doing this that has changed the way that you suggest, or what you suggest to people?
Yeah. So when I originally got healthy, we were studying the omega-3 pathway. My husband had already been studying it for fitness, right? And so one of the things we were still using when we started was fish oil, and we no longer do that for many different reasons. One, there were side effects where people seem to be overloaded in the blood thinning component, and like bleeding the eye, bruising. Doesn't happen when we use flax or chia seeds. It seems like the body will convert what it needs at a slower pace than just flooding yourself with just the pure oil. Plus you add in pollution and the environmental concerns, and we're like, it went away. So that's changed over time. The dosages of the food has changed over time. So since most of our programs, we work with people every day, we've been able to optimize nutrition. So before it was like more vague, like, okay, 75% of your diet. And then over time, we've been able to measure it out. Like, okay, for hypernourishment, 16 ounces is the key, right? For the cruciferous. So over time, we've optimized and adjusted to maximize results. So even though people were getting better from the beginning, it's like universal, like we can just get that dosage in and then optimize it more quickly. So, and also when I first started doing programs, I focused only on nutrition. And then the people who are otherwise happy and loving their life, their symptoms could be gone in 3 to 4 weeks easily. And then I started seeing people who were just so depressed and anxious, and like we were fighting for everything. And I was like, you know what? I got to get these people as healthy as the other folks, and their results will be equally fast. That's how I developed the later protocols, where now I do so much more. That's why I went from just Goodbye Lupus, which is the nutrition, to what the Goodbye Autoimmune Disease protocol is now, which is adding in all the emotional components. We started learning how much sleep people need in order to recover, that people got less than 7 hours, often had slower rates of recovery. So all of the different ways we've been able to optimize over time has come from the vast amount of results that we've seen.
Great. Thank you so much for all that information, Doctor. If we could unmute the audience so they could share their appreciation with Dr. Goldner, please.
Thank
you, Dr. G, so much.
Thank you.
Thank you so much.
I want to be able to give everyone shout outs. So let me see. Pammy says that she's been offered thyroid meds for 15 years after following me. So congratulations, Pammy. And thank you, Rolanda's. And yes, I know Dr. Clapper is a good friend. He's awesome. And I know that he tells everyone that my book is essential reading. So I appreciate Dr. Clapper. Then hi to Beth and Tamara and Deb. I want to say, so everyone who commented, Deke's already drinking their smoothie. So everybody here, let me see, Chris and Annette and Deb and Laura and everyone else who didn't comment or did. I just want to thank all of you. And I hope all of you are just taking what you learned and taking action and you enjoy your life. So thank you so much. I'm going to go do some parenting, and I hope you guys will have a great rest of your day and rest of your conference.
Great. Thanks again, Dr. Goldner.
Bye, everybody.